Adjusting Anti Boutonniere Splints. To put on Anti Boutonniere splints, suggest to patients to put the loop portion of the splint against the palmar surface of the finger so as not to bump against any protrusion on the dorsal side of the finger. Slide the splint onto the finger until in place at the joint, then rotate splint so that the loop is lying midline on the dorsum of the joint. When a patient needs to achieve flexion in order to perform certain tasks, the splint can be rotated to the side. This allows patients to leave the splints on throughout their day. To achieve more pressure on the joint, splay the rings apart using your fingers. Remember that when fitted properly, this splint will put significant pressure on the dorsum of the joint. It is normal for patients to have pressure marks on their fingers. Some patients may not be able to tolerate wearing the splints all of the time at first. In this case, patients should start wearing the splints for short periods of time to gradually increase their tolerance to the splints. To decrease the pressure on the dorsum of the joint, squeeze the rings together. Be mindful that decreasing the pressure will decrease the effectiveness of the splint for its intended corrective purpose. Therapists should ensure that patients understand the proper positioning of the splints for best correction. Patients will often rotate the splint to a position which applies less pressure, which will not be effective.